I think we've all been there. You feel that sudden, sharp twinge in your lower back, and your mind immediately starts racing. Is this just a simple muscle strain, or is it something way more serious? For decades, the medical world has relied on a system of red flags to answer that exact question. But what if that whole system is basically a myth?
So here's how we're going to break this down. First, we're going to look at this traditional safety net, the red flag system. Then, we'll dive into the 4 big cracks that are making the whole thing fall apart. After that, we'll explore some smarter alternatives, and finally, we'll talk about what this all really means for you.
All right, let's start with the big idea that has pretty much dominated back pain management for almost 100 years, the promise of red flags.
This is the one question that sends millions of us to the doctor, right? It's that nagging fear in the back of your mind that the pain isn't just pain. It's a sign of something awful, like a fracture or even cancer. Well, clinicians have a tool designed specifically to deal with this fear.
And that tool is what we call red flags. The idea seems pretty simple. If you show up with certain signs, like a history of a bad fall, or you've been losing weight for no reason, it triggers a red flag. That tells the doctor, hey, maybe we should order more tests, like an MRI. And believe it or not, this approach goes all the way back to a paper from 1924. It's been the trusted method ever since. But here's the problem.
Wow. Just let that quote sink in. For more than 90 years, this cornerstone of diagnosing back pain, this safety net everyone trusted, simply doesn't work. It's kind of staggering. So the big question is, why did it take so long for us to figure this out?
Okay, so let's get into the juicy part. Let's break down the 4 fundamental reasons this system is failing, according to the research. You can think of these as the huge cracks that cause the entire safety net to just unravel.
So the first crack, and maybe the most important one, is all about the tests themselves, or really their lack of power.
In medicine, for a screening test to be any good, it needs to do one of 2 things really well. Either it confidently tells you that you don't have something, or it confidently tells you that you do. The problem is, the research shows that these red flag tests for back pain, they don't do either one very well. Now check out this table, because it really tells the story. Let's look at the risk for a vertebral fracture. Before any test, a person's chance of having one is already tiny, somewhere between 0.5% and 4%. Now look at what happens after the test comes back negative for big red flags like being over 74 or having a major trauma. The probability, it barely moves. We're talking a shift of less than 1%. The test just doesn't make a doctor much more certain that you're okay.
Okay, the second major crack in this whole system is a simple problem of definition. Like, what even is a red flag?
Well, it turns out nobody can really agree. A search of the medical literature found 97 different things being called red flags. Can you imagine trying to do reliable science when the very thing you're studying is defined in almost 100 different ways? It's impossible. It just turns clinical practice into a guessing game.
And this total lack of consistency leads directly into our third problem: complete chaos in the official guidelines that are supposed to be helping doctors.
You would think the rule books would be clear, but they're not. When researchers reviewed 8 major guidelines for back pain, they found that they all recommended dozens of different red flags. And here's the kicker. No 2 guidelines actually agreed on the exact same set. The rule books are all different. So because the definitions are so ridiculously broad, the net ends up catching almost everyone. One study found that over 91% of patients had at least one so-called red flag. When your warning system flags nearly everybody, it stops being a warning system. It's just noise.
And this right here perfectly illustrates the core problem. You contrast that 91% figure with this one. The actual chance of spinal cancer in people with low back pain is less than 1%. So we're using a system that flags almost everyone to hunt for a condition that affects almost no one. All this does is lead to overtesting, overdiagnosis, and a ton of unnecessary anxiety.
And finally, we've got the 4th reason, and this one is the most fundamental of all. It argues that this whole idea of screening for red flags in back pain patients is just a total misunderstanding of what medical screening is supposed to be.
Think about it. True medical screening is for people without symptoms. The whole point is to catch something early, before it causes problems. But if you have low back pain, you are, by definition, already symptomatic. You're already in the clinical phase. So what doctors are doing isn't really screening for some hidden disease. It's just part of the process of managing the symptoms you already have. We've basically been using the wrong framework all along.
Okay, so if the old system is totally broken, what are we supposed to do instead?
Well, the good news is the authors of this paper don't just tear everything down. They actually propose a new, much smarter path forward.
They suggest 3 key shifts. First, we need to embrace watchful waiting, which just means monitoring symptoms over time instead of immediately ordering a bunch of tests. Second, we need to focus on value-based care, always asking if the cost and potential harm of a test is actually worth the benefit. And third, we need to refocus on prognosis. Let's stop using symptoms to hunt for a rare diagnosis and start using them to predict the likely outcome for the patient.
So, after digging into all this evidence, what's the practical takeaway? How should this change the way we all think about our own back pain?
Really, the single biggest idea is this. We need a total paradigm shift. We have to move away from this anxious hunt for some rare, scary diagnosis and move toward a calmer, more rational focus on just managing symptoms and predicting the course of recovery.
So here are the key things to remember. First, low back pain is incredibly common, but it is almost never a sign of a serious disease. Second, those red flag tests you might hear about have very little value in finding those rare diseases anyway. Third, rushing to get an MRI can actually do more harm than good by finding things that lead to unnecessary worry and procedures. And finally, the best first step is often the simplest one, a watch-and-wait approach, under the guidance of a clinician you trust.
And all of this leaves us with a final thought that goes way beyond just back pain. In a world that is always pushing for more tests, more data, and more immediate answers, this research asks a really profound question. When it comes to our health, could learning to practice patient, watchful waiting actually be the wisest and maybe even the bravest action of all?